Namaste. My name is Dr. Chaitra as Niranthara. I'm an obstetrician and gynecologist working in Chandra Rheumatology and Immunology Center. Well, today, the 8th of March is International Women's Day. On this day, we thought we should speak about the common health issues that we women in India face. Indian women's health has always been a matter of concern for a lot of us. That has been because of the poor nutrition, the changing lifestyle, stress, domestic violence, ignorance towards mental health, and also mainly because of the inaccessibility to the healthcare facilities, predominantly in the rural population. So today we will be talking about the 5 common health issues that we women face. The first of which is the breast cancer. We have seen that there is a tremendous increase in the number of cases of breast cancer over the past few years. Multiple reasons are attributed to that. Now, most of the cases, unfortunately, when it is seen in the later stage or the delayed stage. It kind of gets difficult for us to treat. So why, or what are the causes of these breast cancer? Some of the common causes, what they attribute would be because of delayed marriage or delay in the breastfeeding of the first child, non-breastfeeding mothers or someone who's not married and does not have children and they do not breastfeed, obesity. And one of the commonest thing is genetical factors. And I'm sure most of you all must have heard about this. They'll be very concerned if they have another elderly woman in the family who's been diagnosed with cancer. Because yes, it does carry a very important role. The genetical factor has an important role to play in breast cancer. Lifestyle, and nowadays because of the increased intake of alcohol and fatty diet itself also is an independent factor to cause breast cancer. At the same time, poor nutrition again is one of the reasons why breast cancer can occur. Commonly, what we suggest women will be to practice something called the self-breast examination, wherein the breast will be examined on one particular day of every month. Every region of the breast, including the armpits, below the arms, will be examined for any form of lumps. First and foremost, we'll be doing a visual examination standing in front of the mirror to see the symmetry of both the breasts. Is there any change in the color, shape, position of the nipple? Is one breast looking little elevated? Is there any pudy orange kind of appearance? Then we go ahead for a palpation. We will be touching each and every area and seeing if there is any mass in the breast. The second of the common thing what we see in women are cervical cancer. Well, nowadays, I'm sure you must have heard about it and been reading a lot about cancer cervix because the vaccination is started being given free of cost for Indian girls. Well, cancer cervix is a cancer of the mouth of the uterus, which we call as cervix. It is one of the few cancers which is actually caused by a virus. It is called the human papilloma virus. It is one of the causes for the cervical cancer. And hence, it is a preventable cause. In cancer cervix, there's a boon that is called a pap smear. We will be performing a test called a pap smear, which is included in women's annual health checkup, which kind of screens for any presence of cellular changes in the cervix. So that can be pre-cancerous. So why we say it is very essential that you have to make sure you get your pap smear is because we can detect the changes which can convert to cancer later on in life by doing a simple pap smear. Apart from this, the common symptoms, most of the women ask us, what are the common symptoms which causes cancer cervix? Well, the commonest of which can be, first of all, very difficult because they don't have specific symptoms. They can have foul-smelling white discharge. Sometimes the white discharge is mixed with blood, post-coital bleed, having bleeding after an intercourse, intermenstrual, that is between menstruation, they can have spotting or bleeding. In advanced cases, they will start having lower abdomen pain, blood in the urine. If it is extended into the motion bag, again, the symptoms will be as and when it spreads. So pap smear becomes a very vital thing for we women to follow every 3 years. The next of which I want to talk about to especially my young women will be about the polycystic ovarian syndrome. Polycystic ovarian syndrome is a condition wherein predominantly created by hormonal imbalance. Easier to say would be when there is increase in the male hormones in the body. So in a girl with polycystic ovarian syndrome, she predominantly will say her cycles have been very irregular. Sometimes cycles can be absent for a long duration of time, say around 4 to 6 months. Without medications, it becomes difficult for her to even get her cycles. That is because of the hormonal imbalance that she is facing in her body. Along with that, they can have obesity. They can have hirsutism, that is increase in the facial hair. Some of them also complain of acne, black pigmentation on the neck, and in the aspect of the thigh and even in the armpit. This we call, especially dark, thickened skin on the neck is called acanthosis. So these are the few symptoms that a girl can have. So when the girl has her cycles, and if she starts having irregular cycles, something which was coming once in 30 to 35 days, and suddenly it kind of prolongs, and she doesn't get her periods for around 2.5 months, then it is best that you speak to your gynecologist, who will be able to brief you on why is this happening. The doctor will be taking a detailed history. She will be doing certain blood parameters, predominantly the hormones. Along with that, we will also be doing a scan to see if your ovaries is having any kind of polycystic features. And if so, the first and foremost thing that we suggest to women will be a lifestyle modification. Lifestyle modification will include a change in your diet as well as increase in the physical activity. So this will be the first thing that you will get to hear from your doctor. And then depending on how you're responding, we may give you with certain additional medication. The next of the common one, what we see nowadays is heart disease. And nowadays, the incidence of women having cardiac disorders at a younger age is also being pretty high. So cardiac diseases. Initially, we used to say that, in menopause, post-menopause, women are more prone for having heart disorders. And yes, that is very true. But now, change in the lifestyle, change in the eating habits and restricted physical activity is making a woman being more prone to developing cardiac problems. So for these, some of the contributory factors will be because of smoking, alcohol intake, a sedentary lifestyle with restricted physical activity, consumption a lot of junk food, and also because of use of contraceptives in women. We also say be very careful when you're taking contraceptives. So this is one of other triggering factor. So in an annual health checkup, yes, a woman will definitely be asked certain questions. Is she having lethargy? Is she feeling difficulty in breathing when she climbs steps? Is it changed from the past year? And if she has so, she will be evaluated. The cardiac evaluation will be done. The fifth common health problem that we Indian women face is osteoporosis. Well, predominantly seen in the postmenopausal women, where we say the bone starts getting more fragile and they are more prone for having fractures. Well, some of the causes why this can happen will be the vitamin D deficiency or restricted intake. Exposure to the sun is very limited. Sudden weight gain also can cause osteoporosis. Increase in alcohol intake and smoking also are contributory factors for osteoporosis. Along with that, the recent studies have also showed a very high intake of salt also can predispose a woman to osteoporosis. Well, osteoporosis will have to be in your annual health checkup. Even that will be included where a bone mineral density will be performed. And based on that, if required, after the scoring, you will be treated appropriately. In the diet, yes, it is good that we include a lot of calcium, a good amount of vitamin D. Most of recent studies also said that around 70 to 75% of the Indian women have vitamin D deficiency. So it becomes essential for us to investigate them and treat them likely. Now, another, and most of the people actually wanted us to talk about menopause on this particular day. Menopause is a very difficult conditions for women. In our Indian culture, when a girl attains menarche, there's a lot which happens, and there's good family support. She's given good nutrition, and which kind of helps her cope up with the changes in her body. The same thing happens during menopause. During menopause, the hormones kind of take swing. There is a lot of hormonal changes that the body has to get adopted to. So when we say menopause means that there is a woman is no longer having eggs which can cause pregnancy. So 5 years before menopause and 5 years after menopause, she can still have the symptoms of menopause. And these are, as I told you again, it is because of the changes in the hormones. And as the oocytes gets empty, there's a reduction in the estrogen and progesterone hormone, which kind of puts them in a risk. There are a lot of features that menopause women will experience. She will experience hair fall. A male pattern baldness can kind of start setting in. She will experience dryness of the face, wrinkling. Her eyesight may kind of reduce. She will also have loosening of the teeth. The size of the breast may come down. Hirsutism or excessive hair growth on the face, on the upper lip can be there. She can start depositing fat in the abdomen area. Sexual drive is reduced. She is more prone for developing urinary tract infection because the vagina and the urethral area kind of gets really dry. Also, she is prone to develop osteoporosis, which we just spoke about, diabetes, heart problems, and hypertension. So this is a phase where the requirement, the involvement of the family becomes very important. So in a woman who's attaining menopause, because of the hormonal swings, they may also experience a condition which is called the hot flushes because of the sudden deprivement of these hormones. They say they suddenly feel very hot, they start sweating, even the outside environment is not too hot. So in these kind of situations, definitely we will see what is the status of the hormone and perhaps treat them accordingly. Again, menopause is one of the most important things that we have to address women, and the health checkup becomes very vital for her during this particular phase. The last of which we'll be talking about today will be the cancer cervix vaccination. As I already mentioned, cancer cervix is caused by a virus which is called the human papilloma virus. And very happily now in India, the girls are being given this vaccine. It is called the HPV vaccine against the virus which causes the cancer, human papilloma virus. The HPV virus, we have two brands which we usually give, the Gardasil and the Cervarix, given predominantly between the age of 9 to 25. But even a girl who is post 25, if people seek or they want to get the vaccination, then it is ideal that if she's sexually active, we will perform a test to find out if she already has the virus in her body. And only then will we go ahead to give the vaccination. Gardasil is against 4 predominant viruses, and Cervarix is against 2 of the strains. Gardasil is given at 0, 2, and 6 months, and Cervarix is given at 0, 1, and 6 months. If a person is taking the vaccination and she conceives, we do not ask her to abort. We ask her to complete her pregnancy and then continue with the schedule. And in case she conceives and she always has a doubt, should I abort this baby? Will there be any anomalies? No, there is no studies which has shown that there can be development of abnormalities in the baby because of the vaccination. So yes, for girls between 9 to 25, it is vital that they do take this vaccination because it's one of the common cancers in India. Thank you, and a very happy Women's Day.